Polycystic kidney disease, or PKD for short, is an inherited disorder that causes a cluster of fluid-filled sacs called cysts to interfere with kidneys' ability to filter waste products from the blood. The growth of cysts causes the kidneys to become enlarged and can lead to kidney failure. PKD can also affect the liver, pancreas, spleen, ovaries, and large bowel. There are two types of PKD. First, there is autosomal dominant PKD, the most common form. This form is passed down from parent to child through dominant inheritance. Therefore, the children only need one copy of the gene in order to inherit the disease. There is also infantile or autosomal recessive PKD, a rare form of PKD. Passed down through recessive inheritance, this form can be fatal in the early stages of a baby's life. A person that inherits this disease can experience pain in the abdomen, blood in the urine, frequent urination, pain in the sides, urinary tract infection, skin that bruises easily, pain in the back, pale skin color, fatigue, joint pain, and nail abnormalities. PKD is a genetically transferred disease that comes in two different forms: autosomal dominant PKD and autosomal recessive PKD. When the dominant form is passed down from parent to child, the child just needs one copy of the gene to inherit the disease. When the recessive form is passed down, the child needs to inherit a copy of the recessive gene from both parents in order to inherit the disease. Both forms are not sex-linked. People with this condition are born with one mutated copy of the PKD1 or PKD2 gene in each cell. In about 90% of these cases, an affected person inherits the mutation from one affected parent. In infantile PKD, it has been mapped to a region on the short arm of chromosome 6. There is currently no treatment. The disease can only be slowed. Recent studies suggest that drinking plain water throughout the day and avoiding caffeine in beverages can slow the growth of cysts. Aggressive antibiotic therapy is also an option. Iron supplements or infusion of red blood cells are used to treat anemia. Surgery may be needed to drain cysts that bleed, cause pain, become infected, or interfere with normal kidney function. Therapy may include antihypertensive medications, diuretic medications, and/or a low-salt diet. As kidney function declines, some patients need dialysis and/or a kidney transplant. People who have PKD should not drink heavily or smoke. They should not use aspirin, non-steroidal anti-inflammatory drugs, or other prescription or over-the-counter medications that can impair kidney function. Individuals affected with PKD should eat a balanced diet, exercise regularly, and maintain a weight appropriate for their height, age, and body type. Regular medical monitoring is also recommended. At the moment, a form of gene therapy is not available for PKD. To diagnose the two types of PKD, your doctor may use imaging tests to look for cysts of the kidney, liver, and other organs. Abdominal ultrasound is a non-invasive test that uses sound waves to look at your kidneys for cysts. Presently, no specific diet is known to prevent cysts from developing in patients with PKD. Reducing salt intake helps control blood pressure in PKD patients who have high blood pressure. PKD has no cure. Polycystic kidney disease is a fairly common genetic disorder. It affects about 500,000 people in the United States. The autosomal dominant form of the disease is much more common than the autosomal recessive form. Symptoms usually begin between the ages of 30 and 40, but they can begin earlier, even in childhood. Through this project, we were able to learn about how PKD is contracted and see a snippet into what it would be like to have PKD from the symptoms to the medical care that must be taken.